Hi everybody, this is Dr. Arunachalam here. We are going to see about what are the muscles to strengthen for preventing the recurrence of low back pain or to stay away from low back pain. This is a big debate, which muscle to strengthen and what are the exercises to do when you have low back pain. When you go to internet and YouTube, you see lot of exercises, but you are confused most often what to do. In that, certain exercises are going to aggravate your pain and you are going to develop an apprehensive attitude towards exercise, and that is going to even worsen your situation. Now we have come up with some combination of exercises which are really going to work and they have good scientific evidences. When I say scientific evidence, I would like to tell you about a study which was done in 2019, not way back, which states that surgery do not have a superior effect compared to a well-defined physiotherapy intervention. Whenever you go to a neurologist or an orthopedician or whomever it is who diagnose you that you have some discogenic low back pain, we'll talk about a nerve being compressed by a bone impingement or a ligament getting thickened, or ultimately what they try to tell you is your bones are the one which are compressing your spinal cord or your spinal nerve. But most often they won't say why it has happened. Most of the time people will not talk about the muscle which you need to re-educate and strengthen. I strongly believe that if a doctor has to treat a patient with low back pain effectively, he has to assess the patient first, that too using observation, palpation, and examination skills. So, without wasting much time, we will go into the exercises which do not have any sequence. You can do these exercises in any sequence, but try to do these exercises at least 3 times a week. When we say back muscle strengthening, the muscles are not confined only to the lumbar region. It also consists of muscles on the buttock region, on the posterior aspect of your leg, and also on the neck muscles which are getting connected to the back muscles indirectly or directly. The first exercise is called as the spinal extension exercise, where the patient will lie down on his tummy and slowly lift his leg in the reverse direction, one by one each. This is called as shalabasana or ardha shalabasana because you are going to lift only one leg, so it is called ardha shalabasana. The magnitude of the movement need not be this much because once you go beyond certain limit, you may rotate your pelvis. So the next is bilateral lower limb raise. If it is possible for you, you can do, otherwise you need not try. For people who are starting without low back pain, who wanted to stay away from low back pain, can practice this. This is called the quadrupedal position. When you're going on all four limbs, just position yourself so that your back is straight and flat. Make sure that your hands are immediately below your shoulder and the knee are immediately below your hip, and you are positioned with your elbows straight. Now slowly raise one hand and the opposite leg up. It may be little challenging, but you have to maintain this posture maybe for 3 to 5 seconds initially, and you can ramp up. Next, do it for the other side also. As this is a strengthening for a postural muscle, the time for which you are holding matters more than the repetition. Try to increase the time for which you are holding this position with less repetition also. Senior citizens can try an alternate method for this because it will be challenging to go to quadrupedal position for them. In that case, they can hold on to a chair, slightly lean forward, lift their upper limb and lift their opposite lower limb, making sure that their trunk is straight and flat. So, doing all the exercises does not matter. Doing all the exercise rightly does matters. These are the major mistakes what people normally do, rotating the trunk or trying to overdo that. If you can keep a wand on your back or a stick can help you in holding onto your spine without rotation. One thing you have to make sure that all the three segments are in alignment with each other and you are not arching your lumbar spine too much so that you are dropping your pelvis down. Next is the most famous exercise, which is called as bridging, for which you have to lie down on your back with your legs bent, and then you have to slightly raise your pelvis part so that you make a straight line between your shoulder and your knee joint. Do not push with your both hands and slowly lower down. As this is also a postural exercise, my recommendation is going to be holding it for the maximum time. A beginner can hold it for 5 to 10 seconds and you can repeat it for 10 to 15 times in a set of exercise.
remember not to hold your breath while doing this. Next is a very important exercise, which is a side plank exercise, where you can go on to your elbows with your bent knee and going to lift the pelvis so that you form a straight line between your shoulder and the knee again. Here you are going to strengthen your side abdominal muscles and the core muscles. This is an effective exercise. If senior citizens find it difficult to do, you can also alternate it by means of doing the same exercise with your knees straightened. This will not put an extra load on your knee. At the same time, don't try to overdo this if you are having pain. Next, we are going to see about two muscles which are very vital in the management of low back pain. The first of it is called as the transverse abdominis, which is like a corset or a lumbar belt which we normally use for a low back pain. So it is a natural lumbar corset what God has given us. This muscle gets attached from the front of our abdominal muscles and extends back into the spine and gets inserted into the vertebrae. When you are moving, this is going to stabilize your lumbar spine. So how to contract this muscle? Just palpate, tracking from both hip bones towards the midline to a place which is slightly below your waistline. You can see the video for this. Now you have to palpate this muscle and then you have to try to tuck your tummy inside. By tucking your tummy inside, you can feel with your hands that this muscle is working, or this area below your hand becomes tighter and harder. That means you are contracting this muscle. Hold on to this muscle contraction for a while, maybe 5 to 10 seconds, and increase the duration. Subsequently, once you master this contraction, try to move your legs very minimally at your leg and then try to increase the magnitude of your leg movement slowly, maintaining this contraction. The concept is, for a normal person, the brain instructs the back muscles to contract well in advance before your upper limb or lower limb moves. So keeping your back prepared for all these movements. For people who have low back pain, this muscle contraction would be lost. So any movements which they are performing using their leg will result in back pain. So we are going to strengthen the stabilizers of your lumbar spine. Thereby you can freely move your leg. The next muscle is the multifidus muscle, which is located very deep inside your body, which is not like the superficial muscles which helps in moving your body. Instead, it tries to stabilize each and every vertebra when you are moving your trunk. Now I understand you are asking me loud and clearly why none of the MRI tell us about this particular muscles, because these MRIs are always directed towards surgery. So if you see in an MRI, the first one is a normal MRI which shows the muscle bulk of the multifidus to be good, and in the subsequent MRIs you can see the multifidus is very poor. It is not that the MRI cannot detect whether the multifidus is weak or not, but why it is not reported in most of the MRI report. Now my request is you go through some of the articles and researches which are done on multifidus and how important it is in low back pain management, and why these doctors don't talk to you about strengthening this multifidus, and you can do a self-analysis. So let us know how to contract this important muscle. Keep a small towel roll below your lumbar spine, or preferably you can also have somebody's hand below that who is helping you, or even you can have your hand just below your lumbar spine. And now you have to slightly press against this towel roll or hand which is kept below your lumbar spine. The movement should be so subtle that only the area which is adjacent to your vertebra contracts. Okay, this lady is doing it by means of a sphygmomanometer, where she is gauging the amount of pressure. If you have any problem in doing this exercise, you very well contact your physiotherapist who can teach you this exercise, because it is little tough for you to do the exercise. Once you master this, like the transverse abdominis exercise, you have to slightly move lower limb to and forth in less magnitude, and later on increase the magnitude slowly, so that you do that without losing the contraction of the multifidus. So my dear friends, I will tell you regarding low back pain, a good doctor is the one who gives enough time for the natural recovery to take place and try to improvise on the abilities of his patients rather than posting him onto surgeries. So with this I conclude. I'll meet you once again with some other set of exercises and some other set of remedies for your problems. Thank you. Stay safe.